My name is Kerry Hamilton and I'm Head of Nursing for the Rutherford Cancer Centres. I have particular responsibility for infection control. The Rutherford Cancer Centres are taking a lot of steps to be COVID safe. We introduced reduced footfall from the outset, so anybody in the business who didn't need to be in the centres were asked to work from home or in offices away from the centres. Our patients are particularly vulnerable, obviously, because of the treatments that they're having, and it was really important for us to keep the footfall down and to maintain optimum safety for our patients. We introduced healthcare patient coordinators at the doors, and these staff have been screening everybody as they come into the centres, patients, staff and everything else. Therefore, they ask them screening questions around COVID, they test their temperatures, and they make sure that they're safe before they're allowed to enter the centres. They give them a mask to wear, so everybody coming into the centres are wearing masks whenever they're in the centres, and that includes staff. They carry out lateral flow tests twice a week, or in between if somebody requires a test. All staff are tested twice a week, and this gives patients a lot of confidence. There's been some fantastic patient feedback of those who are certainly aware that staff are being tested, and it makes them feel very secure. Patients are also contacted very regularly by Rutherford staff. So if they're coming in for treatment, the staff will contact them before they come in for treatments, directly by telephone, and just screen them and make sure they're comfortable in terms of coming here. They are often escorted by family and or friends in the cars to bring the patient to the centres. However, in keeping the footfall down, we do encourage patients to come into the centres by themselves. We do also realise that this is a really stressful time for patients, so staff use their professional judgment, and if they feel a patient needs to have a member of their family with them or a friend, then they make that judgment and that call. The focus for us is to maintain safety for patients, and that is not only in terms of screening, it's in terms of making sure that the centre is kept very clean and there are plenty of stations to sanitise your hands. In terms of patient safety, we also manage their appointment times. So during this COVID period, we've made sure that we space their appointment times appropriately so that they're not clustered in the waiting area. We've also managed the waiting area to make sure that people aren't sitting within 2 metres of each other should they be waiting in that area. All patients are tested before they start treatment, and they're on at the consultant's discretion or patient request. We increase the cleaning schedules from the outset, so we have the facility to deep clean however many times a day is required. The most positive aspect of this is that we've had really positive patient feedback during this period. We've maintained treatments throughout. We're a recognised green COVID centre. We've really gone out of our way to maintain patient safety because we really recognise how vulnerable our patients are. And I think it's a real positive reflection on the whole company that patients feel so secure coming here for treatment during this pandemic.